Then we of course come to our pregnant mother. They are anemic. They don't take regular ANC visits. They don't try to find out whether they have diabetes or hypertension or they have a problem. And we tell them, please don't smoke, don't take tobacco. They may take some amount of it, they will not take a low burden for their babies. And the use of ultra-processed food, any amount of it is given with the child is only 5 rupees a packet, 5 rupees for 10 biscuits. Yes, it gives them the satisfaction, hunger satisfaction goals, but it is 0 calories. And it actually, ultra-processed food is a trans fat. They boil throughout the days, 24 hours, whatever your, what is that, vada pav, whatever is there in that dirty oil. And the child takes that, and the wiring, the brain synaptogenesis also goes down. This has been proved scientifically. In ultra-processed is eaten regularly. Everyday pizza, everyday hamburger, everyday, what is that, chicken lollipop and whatever it is loaded with sugar, loaded with salt, and even hydrocarbon. So it is bad for the effect of the growth and the development. What is important to know the socio-economic status of the mother? Literacy is very, very important. Is to educate them. Many of the problems can be sorted out. Birth spacing, yes, we know there is gender bias. I don't know how we can go. And a lot of cultural and traditional beliefs which are there, which is really coming in the way of the development of society. Nutrition, very important. This is a portion of Jan's there. But I only want to add the preconception stage where you should take care of the mother's food, folic acid, iron. Also rule out any infection which the mother has. Treat the mother if she has caused any infection. If vaccination is required, we should see that is given. That is the preconception thing. Then we of course give breastfeeding, deworming. You look out for the child if the child is malnourished. Take care of it and follow the HbA1c and APYC program, which is really very good program, at least up to 15 months. We try to take it up to 2 years because we wanted to know the growth of 3,000 days. So we try to do that, and we are doing it, of course, in Norway. But what it is, it covers everything. It covers the growth, it covers the nutritional status, it covers the milestones of the child. Right up to 15 months, you have a child which is well grown and all the problems they sorted out. So I want to stress these are very important for the brain. These are nutrition, we call nutrition for the brain. Protein is a global thing. Polyunsaturated fatty acid which you get from nuts and seeds. And the cheapest one is the groundnuts. It's available everywhere. Don't go for almonds and all. It's a very, very costly. Those who can afford 100% very good. Zinc, it takes care of the heart rate, respiratory rate and the circulation of the body. Very important, zinc is very important for learning. Memory and learning together with iron. Zinc and iron takes care of the memory of the child. Take a child who comes from school and if a child puts the bag and goes to sleep, he's anemic. I can tell you that. No child comes back, he wants to play around and go around. But he does that, please find out what is the problem with that child. Worm infestation, very common to give rise to anemia. And that again causes malnutrition. We come to labor room and please remember, I consider this is one of the most important after delivery factors. This is the place where infections can take place. This is the place when birth asphyxia can take place. This is a place where the infection and all problems can stand. Your labor room temperature should be between 26 to 29 degrees, otherwise the child will get hypothermia. If you don't put the baby to breast immediately after birth, you will get hypoglycemia. If you don't wash your hands or the nurse doesn't take care of that hygiene, he's going to get infection. You get vertical infection from the mother to the baby and also around the environment. So that also causes. And we know we have a problem with low birth weight babies. It's something I don't know how it can be sorted out, but it is a real major problem. And more than that are those wards for dead babies. Those who come shoot down of 6 to 36 weeks onwards, and they are lower. They are the ones who will have a lot of problems, especially with hypoglycemia and of course birth asphyxia is quite common. I have seen from the reports that I see. Something is going wrong in the labor room. There is somebody who should know. Capacity building of every nurse and anybody who is in the labor room should be really taken care of. You have got various programs. Lakshya program, various programs are there. But still why it is happening? It is happening because nobody is monitoring. There is no accountability. Baby was no water, he came stillborn. Baby didn't cry or baby not, they will just write stillborn and pass it on. It's not stillborn. Even if a baby gasped, we have to resuscitate him and lift him. So what is wrong? Why don't you learn and why don't you do something for them? So that is there we know steroid, anti-radiant steroid to prevent prematurity. And as I said, temperature, air rate, breathing and circulation, very, very important for a baby to be steroid. That's why. Every newborn baby who cries and comes out, he has innate capacity and he's got built himself. They can always maintain themselves. Within minutes, to see a baby, within minutes or even half an hour or 45 minutes, he will crumple up. Advocate what you call abdominal delivery. As soon as the baby is born, put him onto the mother's abdomen. Don't cut the cord. We have seen that if you leave it for 1.5 and 3 minutes, nothing goes wrong. Baby automatically climbs and goes up to the breast, and he loves that amniotic stings which is on the mother. I mean, you and I don't like it, but the baby loves that smell, and the baby goes on putting his hand smell, goes up to the mother's side. No one is given part or everything at that time, and it beautifully sucks. You do not give the baby to the mother within that first 45 minutes. 100% he will do hypoglycemia. Second stage of labor, placenta is also separating. As the placenta separates and the baby is coming out, the amount of nutrition, oxygen, circulation starts going down. So what the baby, when he comes up, he is hungry. Mother is not hungry. Baby is hungry, but everybody runs to the mother, cover her up, clean her, and that baby is left into the open air. I mean, somebody puts in that tray. That tray is horrible. It can just conduct to the conduction heat loss. It is the worst form of making the baby cold, you know. And I don't know, I always say give that way to the office bearer, they can put a pen and pencil and but still today also I am seeing in certain places the baby is taken in the tray. It should never be taken in the tray. Take a warm cloth, that is what it is. He loses his heat by evaporation. Then you put on a fan, mother is hot, the nurse is feeling hot, and the baby, I always say, if I am feeling uncomfortable, my baby is comfortable. And that is what the temperature should be for the you should be uncomfortable. Then the baby is very fine. But feed the baby immediately so that he does not go into hypoglycemia. And you will see that baby automatically gets his environmental factors. This is immediately social function, his heart is moving, his abdomen you hear growing sound, sometimes they pass meconium, sometimes they pass urine. And all his physiological functions are already provided. His genes are normal and the environmental factors, that is all your neighborhood factors which I told you, must be in order. These are gene diversity. Please remember, every baby comes out is not the tick of a clock. He must breathe. He must pass meconium. He must pass no, they don't do that. They have their own way of doing everything which is the first copy of that. They move their hand. They will put their hand on the head. Anything they can do. These are all gene diversity that can happen intentionally.